Hey guys, welcome back to the channel Optometry Goes. So today we are here with our second video of our contact lens series, that is indication and contraindication of contact lens. So before starting the video, if you have not subscribed the channel, please subscribe the channel and press the bell icon for more updates. So let's start the video. So first is indications and contraindication of contact lenses. So first we have to understand like which patients are eligible for contact lenses and which patients are not eligible for contact lenses. So first is what is the principal indication for contact lens. So we have to do a thorough examination of each patient. We have to take history, we have to understand the medical condition, we have to take us understand that what is the expectations of the patients and what are their refractive needs and response to the trial fitting. The trial fitting you are going to do. After that also we can decide that is this patient suitable for contact lens or not. So mainly there are two main indication. One is your optical indication and second is your medical indication. So first we will try to understand the optical indication. So in optical indication, most contact lens wearers are fall into this group. Okay, that is your refractive error and presbyopia. Means optical indication means when patient required some contact lenses for the refractive errors or the conditions like your presbyopia. Means that is not much related with your medical conditions like your keratoconus, irregular corneas and the other things. Okay, so the great majorities people in this optical indication yes are from myopic with or without astigmatism. Now we'll talk about the optical contraindication. So first is your systemic or allergic eye condition which can aggravate the contact lenses. Is if there is any systemic condition or an allergic eye condition, we should not prescribe the contact lenses. Second is inability to follow lens cleaning, storage, aseptic procedure. If your patients are not able to follow this condition, we should not give contact lens to the patient. Third is your personal poor hygiene, inability to understand contact lens related risks. Fourth is your immunosuppression, if there is any disease which is related to immunosuppression or patient is using any systemic drugs for the tear film quality. Okay, which affect the tear film quality if patient is taking any systemic drugs, so you should not prescribe the contact lens. Fifth is your if there is pregnant woman, lactation, menopause or possible intolerance and the refractive instability, because these condition can lead to the refractive instability. So if there is some condition like that, so we should not prescribe contact lens to the patient. Next we'll talk about the medical condition for contact lens. What are the medical conditions for the contact lens? So first is your keratoconus, which is most common these days. So contact lens improve the visual acuity in this keratoconus by neutralizing your irregular corneas. And second is your irregular astigmatism or corneal opacification. If there is any irregular astigmatism or corneal opacification is there, you can go for the contact lens. Third is your anisometropia. If contact lens you will prescribe, so it will minimize the anisoconia and help prevent amblyopia when spectacle correction is poorly tolerated. So fourth is your unilateral aphakia. If you prescribe contact lens to the unilateral aphakic patient, so contact lens reduce the image size difference and enable the binocular vision. Fifth is nystagmus. We can prescribe contact lens in case of nystagmus also. Contact lens move with the eye and often provide better visual acuity than the spectacles. So sixth is your after refractive surgery you can provide the contact lens, and after penetrating keratoplasty, these are the few conditions in which you can provide the contact lenses. And eighth is your cosmetic and the therapeutic purpose. If there is any corneal opacification like that or any therapeutic needs like your bandage contact lenses, if you want to prescribe, you can prescribe the cosmetic and therapeutic purpose. Next we'll talk about the RGP contact lenses. When you should prescribe the RGP or what are the indication for the rigid gas permeable contact lenses. So first is when there is regular astigmatism greater than 1 diopter, or we can say if your spherical to cylinder ratio is more than 4:1, means your sphere is suppose 5 diopter and cylinder is 3 diopter, so it's not into the 4:1, so you have to go for the RGP contact lens. Second is your irregular astigmatism. Third, patient with difficulty manipulating a hydrophilic contact lens. If patient is some difficulty with the soft contact lenses, you can go for the RGP. And you can go for the post-surgical fits like post-refractive surgeries, post-penetrating keratoplasty. And the fifth is your corneal opacification. If there is any corneal opacification, you can go for the contact lenses. Sixth is your myopia control, like your ortho K and all. So now we'll talk about the contraindication, in which condition you should not give the contact lens. Sports activities, if there is sports activity because of your high movement of the body or the eyes, lens can come out. And the second, discomfort of the rigid gas permeable lenses. If patient is still after 1 week or the after giving some time, still patient is not adaptive to the RGP, or if there is discomfort, you should discontinue. And if there is any sporadic use, you should not give the RGP contact lens. Next, we'll talk about the soft contact lens indications. So first is your emmetropia with minimum astigmatism. If there is emmetropia with minimum astigmatism, you can prescribe the soft contact lens. If there is intolerance from the RGP, or you can give the for the athletes, because which kind of movement is there, if they move very fast also, eyes are moving fast, there is not much dislocation of the lens. Fourth is your infants with ocular pathologies such as aphakia. And fifth is your patient with the nystagmus, because lens will move with the eye, so patient will not feel that. Sixth is your excessive wide intrapalpebral fissure and the patient with large iridectomies. Okay, so in these conditions also you can prescribe the soft contact lenses. Now there are few other lenses also which we will understand when we have to prescribe that. So first we'll talk about the orthokeratology lens. So if there is low to moderate myopia, it will work better. So basically ortho K lenses, if you want to do myopia control in children and adolescent, you can prescribe the ortho K. So patient preferring spectacle free daytime vision. If any patients which don't want to wear spectacles in the daytime, your ortho K lenses can help. Second, we'll talk about the scleral contact lenses. Mostly these will help in the keratoconus and other corneal ectasia when cornea is thin or any irregular astigmatism or irregular corneas are there. You can go for the scleral contact lenses. Second is your severe dry eyes. Third, irregular corneas like we told before, post keratoplasty, also post RK surgeries, and corneal scarring or surface irregularity is there, we can go for the scleral contact lens. Third, we'll talk about the toric contact lens. When there is regular corneal astigmatism, you can go for toric. If astigmatism not adequately corrected with the spherical lenses, sometime your astigmatism is out of 4:1, like your sphere and cylindrical ratio, if it is more than 4:1, so we should go for the toric soft contact lenses, or you can go for the RGP also. So patient intolerant to spectacle induced distortion, if there is spectacle induced distortion, you can go for the toric contact lenses. Now the last one is your cosmetic or prosthetic tinted contact lens, you can say. So if there is any iris defect, iris coloboma, aniridia, anything is there, you can go for the cosmetic contact lenses. Second is your corneal opacities. If there is very severe corneal opacities and patient wants to just for the cosmetic purpose, you can go for the contact lens. And third is your cosmetic enhancement of the eye color. So sometime for any function and any other things, if you want colored contact lens also, that is also there. So next is your primary ocular contraindication. We'll just talk about few general contraindication in which condition we should not prescribe the contact lens. So if there is any acute or subacute inflammation of the anterior segment of the eye, so we should not prescribe the contact lens. If there is acute or chronic ocular infections, so these all things we have to see before contact lens fitting when we'll do the slit lamp. When you are doing the slit lamp, so you should able to see all those things So third is your any eye disease affecting the cornea, conjunctiva, lids, epithelial fragility, endothelial failure, dry eye, allergy, pinguicula, pterygium. In these conditions, you should prevent giving the contact lens. After when these conditions are treated or managed, after that you can go for the contact lens. So if there is any corneal hyperesthesia, if there is uncontrolled glaucoma, vitrocorneal touch in aphakia, there is psychological intolerance to the placement of foreign body in the eye. So in those conditions, you should prevent the contact lens. So first, if there is patient which is like not motivated for the contact lens, so you should not give, because the patient is not motivated, so maybe he or she will not follow the your care and maintenance of the contact lens, which will at the end which will leads to the your any infection through the contact lens or any other problems. So these are some indication and contraindication of the contact lens which you have to take care. Thank you so much. So thank you so much for watching the video. If you like the content, please like, share, subscribe the channel and press the bell icon for more updates. Thank you so much for watching. Bye bye.